Okay, so basically, the big question that I'm asking here is the question of how long we can continue to avoid most of the activities of regular life without supreme data that that's actually helping too much. It is one thing to say that we don't want people willy-nilly infecting each other. And again, even that question is now on the table because seriously, we have to wonder if nothing changes over the next couple of years and if we are aiming for herd immunity over time, is that better than aiming for herd immunity as quickly as possible like Sweden was doing, right? Sweden was slowing the spread somewhat, but not too much since they now have Stockholm, like 40% penetration rate of this disease. So the question becomes, okay, do you want the spike to happen now or would you like the spike to happen later? And that's what people are beginning to realize. Okay, but if the choice is between that or responsibly social distancing or complete lockdowns, then complete lockdowns really should not be on the table. These complete lockdowns are not useful. The complete lockdowns do not have an endpoint. They do not have a logical endpoint because, again, nobody has yet really suggested the vaccine is going to be available tomorrow or a therapeutic will be available tomorrow that allows us to all go back to our lives. So you're starting to see mayors, hypocritical mayors actually, going out and saying, we're going to arrest you if you don't socially distance. Now, I get it. I do. I get arresting people. Lori Lightfoot also was disobeying her own orders in Chicago to go get haircuts in the middle of the pandemic and then proclaiming that as mayor, it's very important she get a haircut. Here was Lori Lightfoot suggesting that people would be arrested in Chicago.
We will shut you down. We will cite you. And if we need to, we will arrest you and we will take you to jail. Period. There should be nothing unambiguous about that. Don't make us treat you like a criminal. But if you act like a criminal and you violate the law and you refuse to do what is necessary to save lives in the city in the middle of a pandemic, we will take you to jail, period.
Okay, now all of that is well and good unless what you're talking about is people just going to a park. If what you're talking about is, like, really, if you're talking about one of those big social gatherings with 1,000 people infecting each other in downtown Chicago or something, in the south side of Chicago, which is what we were seeing a couple of weeks ago, fair enough. I don't even have a problem with Bill de Blasio arresting people in mass gatherings, although it's weird that he would single out just the Jews in his tweets. A lot of people were doing that sort of stuff. But the idea that the NYPD is going to come break it up or that Lori Lightfoot's going to come break it up, that's fine. But that changes, that math changes when you start looking at ridiculous shutdown orders of public places like beaches or parks. That's what we've seen in California. Instead, how about this? How about we actually engage in data-driven methods that are meant to reopen to the extent that people can actually live with it, at least for a certain amount of time. Ron DeSantis over in Florida, for example, he's been ripped up and down. Why? Because Ron DeSantis didn't shut down Florida fast enough. There's only one problem. The results in Florida are not bad. Florida's doing about the same as California. You know what Ron DeSantis didn't do? He didn't shut down the entire city. The entire state. He didn't. He said big cities are going to have to shut down mostly. Smaller places, not so much. Here was Governor DeSantis, who was ripped. You remember, the media coverage endlessly was about how evil Ron DeSantis was for not preemptively shutting the state. The beaches are full. Spring break. Oh, my God. People are going to die. They were all young. None of those people were going to die, or at least very few of those people were going to die. And Ron DeSantis, his state is basically fine. Here was Ron DeSantis yesterday explaining his approach to this thing.
The only thing we have to fear is letting fear overwhelm our sense of purpose and determination. We need to focus on facts and not fear. And I think that there's been a lot that's been done to try to promote fear. We were told over and over again, Florida was going to be just like New York when it came to the coronavirus. Well, let's look at the tail of the tape. How close were we to New York? Fatalities. Obviously a much different picture.
Okay, and he is correct about that, obviously. DeSantis also explained that he is going to set up mobile RV labs so that they are going to be able to check out old age homes, which, of course, is sort of what Scott Atlas is suggesting, right? That what we have to do is mainly focus on protecting the most vulnerable populations. Here is DeSantis. Again, why DeSantis became the criminal here is pretty incredible. DeSantis became the criminal because he's a Republican in the view of the media. But guess what? His state is fine. Here's DeSantis.
I'm going to be unveiling a mobile RV lab that we can drive across Florida. The results are going to come back in 45 minutes. So we're going to go to nursing homes. It's going to be our number one thing. Test the staff, test the residents. And eventually, Maria, once we get enough rapid tests, I'd like to be able to test the family members and let them go visit their loved ones. These people haven't had visitors for close to 2 months. That's not an easy thing. Obviously, we got to err on the side of safety. But if a son or daughter can get a test and they're negative, then they should be able to go in and see their parents.
So what exactly did DeSantis do? The Wall Street Journal has a piece today called Smart or Lucky? How Florida Dodged the Worst of Coronavirus. When the coronavirus pandemic swept toward Florida, public health professionals nationally warned of a potentially devastating wave of infections that could imperil the state's large senior population. But so far, the state seems to have dodged that fate, despite not following advice to impose measures such as an early blanket lockdown to minimize spread. So what exactly happened? DeSantis restricted visitation to nursing homes, but he left early lockdown decisions to local authorities. Mayors in some hard-hit large communities shut down faster and more aggressively than the state, gaining valuable time. Walt Disney World closed 2 weeks before the statewide order. Spring breakers went back home. Some scientists point to Florida's low population density, others to its subtropical climate to explain fewer infections. Though the governor did not impose a statewide stay-at-home order until April 3rd, people began hunkering down en masse in mid-March, according to firms that analyze anonymous cell phone data. That was around the same time deaths in the U.S. topped 100, and residents of New York started staying home. The state needs to double its current volume of testing to more than 32,000 tests a day to detect and respond to flare-ups, says Charles Lockwood, the dean of University of South Florida Morsani College of Medicine. That will take about a month. As of Saturday, Florida had more than 35,000 cases of COVID-19, the disease caused by the new coronavirus. In late March, a model developed by the Institute for Health Metrics and Evaluation at UW was predicting nearly 7,000 deaths in the state by August, a figure the modelers said could shift depending on adherence to social modeling. Florida has 6 deaths per 100,000 people as compared to 42 in Louisiana, 56 in Massachusetts, 97 in New York. California had 5 deaths per 100,000 people. Texas had 3. So maybe it turns out that local leaders have the best view of this stuff, that local leaders actually did what they were supposed to do in their local communities, that individual human beings are risk averse and smart enough to recognize that they're going to have to avoid risk. The notion that DeSantis did something totally wrong by allowing local officials to have their way is just ridiculous. He is not wrong about this. In fact, it was a better data-driven program than a lot of what was happening statewide. Like New York State, upstate New York should not have shut down. New York City should have shut down. Places, California. You think Central California should have shut down? There's nobody in Central California, right? And LA is very spread out. LA shouldn't have completely shut down. We should have socially distanced, and maybe in downtown LA, but even there, the population density isn't that high. In San Francisco, you do a shutdown, and then you let people back out again. New York City is not like other places. New Orleans is not like other places. Detroit is not like other places. And treating all those places like places within the state is idiotic. Treating Philadelphia like the suburban and rural areas outside of Philadelphia is ridiculous. That's not data-driven. You want to know why DeSantis didn't get crushed? DeSantis didn't get crushed because people basically did the responsible thing. You know what? You want to know why New York got crushed? Because New York is New York. That's why New York got crushed. Yes, there was some mishandling. I've pointed out the mishandling. But in the end, we are drawing closer and closer to the reality of the situation, which is going to be that if nothing happens in the near future, all we can do is protect the most vulnerable people in our population and then let everybody else go back to work. And we have to determine what percentage of those people are actually vulnerable and what percentage are not. One of the things we've heard is the question, and it's a serious question, what percentage of Americans are actually vulnerable? Like seriously vulnerable. If you go by population, I'm going to look it up right now. The population statistics in the United States of U.S. by age, the population of the United States by age, there are about 15 to 19. There are about, let's see, the population of the United States, there are about 20 million people who are under the age of 5. We really start to balloon out at age 55 plus. Total, you're talking about 20 million there. You're talking somewhere in the neighborhood of 45 to 50 million people who are above the age of 60 in the United States. And then you have to figure out how many of the remaining population are people who have pre-existing conditions like obesity or diabetes. But once you figure that out, then you have to determine who's healthy. And if that healthy, let's say that healthy population, let's say the healthy population of the United States is somewhere in the neighborhood of 50 to 60%. Okay, well, if all those people get infected and none of those people die, which is basically what COVID-19 is doing, if you're young and healthy, you're not dying from this thing, then you have to start thinking about how close are we actually to herd immunity? What are the possibilities for herd immunity? Yeah, I know these have been verboten words. We're not supposed to say herd immunity anymore. But what do you think a vaccine is? So either the vaccine is going to do it or your natural immunity is going to do it. And the question is one of those things possible and is one of those things not possible? And meanwhile, one of the reasons why people are a little doubtful about these statewide lockdown orders is it seems like there's a wild coincidence in which all of the places that are locking down most harshly are also eager to push world-changing social policies. I hope you enjoyed that clip from The Ben Shapiro Show. If you did, go ahead and hit the subscribe button so you stay up to date on all of our future content.